Hello everyone, welcome back. Today I am going to cover regarding allograft, bone bank or tissue bank. I will start off with an introduction, advantages of allogenic over autologous bone graft, donor screening, procurement of tissue, the tissue processing, the disease transmission, the disadvantage of allograft. Bone is the most frequently transplanted tissue in humans with the exception of blood. It is used in the treatment of non-union and delayed unions, replacement of bone defects, the tumor defects whereby filling of bone cavities, osteotomy wedge, arthrodesis procedure, in revision of total knee replacement and total hip replacement, spinal fusion, augmentation of skeletal deficiency. The advantages of allograft over autologous bone graft include there is no donor site morbidity, no blood loss involved, unlimited volume of graft, it can be taken from any bone, it has better structural property. It can be processed in variety of structural forms. The aim of tissue or bone bank system is to provide on-demand graft which is sterile, non-immunogenic, retaining biological and biochemical properties. Sterilization method. Federal law mandates that tissue bank adhere to donation and preparation standards that evaluates allograft tissue for infectious disease. This involves two critical phases of evaluation: the donor screening and tissue processing. For donor screening, it depends whether the donor is cadaveric or a live donor. The donors must be screened for infectious disease, malignancy, autoimmune disease, major systemic illness, or any infectious disease risk factor, example in intravenous drug user. Death due to unknown cause should be avoided. The ideal donor should be an healthy adult less than 55 years old with no known medical illness. Procurement of tissue. For cadaveric tissue, it is done within 24 hours of death. Live donors who undergo surgical procedure, example in liposuction, or in amputation procedure or cases. For tissue preservation or tissue processing, as in the case of sterilization, allograft preservation may be achieved by way of more than one method. Fresh frozen allograft represents the simplest preservation method that tissue banks use commonly. Upon harvesting, the graft is frozen for 2 to 4 weeks, during which time the serologic studies are obtained. After that phase, the graft is thawed and soaked in an antibiotic solution for 1 hour before being frozen to -80 degrees Celsius. The graft can be stored for 3 to 5 years. Regarding tissue processing, after consent procedure taken, the screening, the bone is placed in saline at 60 degrees Celsius for 3 hours. The bone pieces washed free of blood and marrow using a jet lavage. Place in 70 degrees of ethanol to remove the fat. Terminal sterilization with gamma radiation or ethylene oxide. Then we freeze dry for storage. Bone is stored in -80 degrees Celsius. It is kept in polyethylene sleeve. The bone is issued after all the sterility tests and culture report are negative. Please remember that fresh frozen bone is stronger and better structurally graft than the freeze-dried bone. In cryopreservation technique, it allows up to 10 years of shelf life. It involves cellular water extraction and the use of cryoprotective media such as dimethyl sulfoxide or glycerol to aid in controlled freezing of the allograft. The graft undergoes a long-term storage in liquid nitrogen at -196 degrees Celsius. The cryoprotective solutions are associated with diminished intravascular immune response by the host and heightened angiogenesis. Cryopreservation may allow for cell viability, while fresh frozen and freeze-dried graft do not. What are the chances of disease transmission? HIV transmission is a concern. Screening is mandatory. It is preferable to do a second test to take care of the window period. Removal of blood, freeze drying, ethanol, irradiation can make the risk to nil. Apart from HIV transmission, the risk of bacterial contamination of bone allograft depends on the technique applied for procurement, preservation, and bacteriological control. Under the usage of optimal condition and overall infection rate, around 6 to 9% has been reported. For immunogenicity of bone allograft, no tissue typing is needed. The incidence is reduced by complete removal of blood, again freeze drying, or irradiation method. What are the disadvantages of allograft? The time and source needed for screening, processing, distribution. Donor-to-donor variation in quality, risk of bacterial or viral infection, and lastly, the cost is very expensive. Yay, we have reached to the end of this video. See you in the next one. Take care and bye.